Hello and welcome to our show, Health and Wellness Save a Life. Well, every life is invaluable and precious. The problem of sudden cardiac death is a major concern all over the world, affecting people of different age groups. When it comes to India, the problem has escalated due to the sudden change in lifestyle and food choices. When medical emergencies like a cardiac arrest happen around a person, it's important to be prepared. If you're aware and informed, then you can take steps to revive a person and save his life. Worldwide, millions of people die of sudden cardiac arrest every single year. This is partly due to limited and sometimes ineffective bystander CPR. Many adults in cardiac arrest can be revived with intact neurologic function if the bystanders provide immediate CPR. Raising public awareness and understanding of the practical applications of CPR is an essential strategy to increase CPR success in cardiac arrest cases. It's even more important to learn about CPR if you have a loved one who has a history of cardiac disease. As research reports that the majority of cardiac arrests occur at home, Save a Life is an initiative through which people will be made aware of the early signs and symptoms of cardiac arrest so that patients can get to the hospital in time and also be trained on giving CPR if the need ever arises. Today we have with us eminent cardiologists who can help you understand sudden cardiac death and the role of CPR to revive and save a life. We have with us interventional cardiologist and diabetologist assistant professor at the KMCH AN Clinic in Chennai. That's Dr. N. Muhasuddin. We also have with us Dr. Rajneesh Kapoor, a Vice Chairman, Interventional Cardiology, Heart Institute, Medanta, the Medicity in Gurugram. Also, interventional cardiologist of Varun Cardiac Clinic in Mumbai, Dr. Mukesh Parekh, joining us. Thank you so much for joining us on the broadcast. Let me take my first question to Dr. Muhasuddin. It is seen that heart attacks are more common in obese people. If you could take us through the relationship between obesity and cardiovascular disease. Doctor.
Yes, of course. Obesity is an independent solo player by itself for developing heart attack. It also contributes directly to development of the important cardiovascular risk factor like diabetes, hypertension, dyslipidemia and sleep disorders. Excessive fat accumulation below the waist is called central obesity. Excessive fat accumulation above the waist is called abdominal obesity. Abdominal obesity has adverse outcome. The waist circumference is a hallmark of the abdominal obesity. Its waist circumference more than 100 cm in men, more than 90 cm in women is considered as abnormal. Ideally, it should be maintained less than 90 cm in men, less than 80 cm in women. Abdominal or visceral fat is biologically very active fat. It continuously pours multiple pro-inflammatory markers into the circulation, leading to the chronic inflammation of vessels and occurrence of CVD risk. Healthy lifestyle changes like increasing physical activity, stress relief, intermittent fasting and especially avoidance of ultra fast food may help us to overcome this obesity pandemic in our world.
Well, how much does smoking increase the risk of heart disease? Does quitting smoking improve the heart health? Dr. Mukesh Parekh.
Smoking is very important risk factor and it increases mortality by all cause. So whether it is a active smoking or a passive smoking, both are dangerous. So we have to see that nobody smokes even around us. It definitely increases the mortality and a death rate. Now, if you stop smoking, definitely it reduces all the risk. But only thing is you have to stop smoking for longer period of time. If you stop smoking for 10 years, Your pre-smoking risk factor comes only after 10 years. So you have to be very careful and avoid active and passive both smoking.
Let me take my next question to Dr. Muhasuddin. What is a heart attack? What conditions can cause heart attacks? Doctor.
Heart attack or myocardial infarction occur when blood flow, which carries blood and circulation to the heart muscles, is totally occluded or severely reduced. It is a real emergency. Time is muscle. If we will not restore blood circulation immediately, it's leading to myocardial cell death. Atherosclerosis of coronaries is the most common cause for myocardial infarction. If a atherosclerotic plaque ruptures, underlying endothelium is exposed to blood elements leading to the clot formation and occlusion. Heart attack is leading cause of death all over the world. Lately, its prevalence alarmingly increased in younger productive age group and in women also. Risk factor for heart attack include age, family history of heart attack, diabetes, dyslipidemia, hypertension, obesity, smoking, active and passive, secondary smoking, drug abuse, cocaine, alcoholism, undue stress, unplanned unhealthy diet, unplanned unhealthy processed diet, sedentary lifestyle, importantly disruption of the circadian rhythm, shift worker disorder, lastly not least infection, especially post-COVID sequelae.
Does your heart change with age, and what can one do to help reduce the risk of heart disease? Dr. Rajneesh.
Yeah, Divya, lots of changes occur in our body as we age. So it also happens with blood vessels and the heart. So what happens, the lining of the blood vessels become very stiff as we age, and the walls of the heart, they also become thick and stiff. Now this stiffness of the blood vessels lead to high blood pressures, and the thickening of the heart wall lead to decreased compliance of the heart. So heart is not relaxing properly, and that leads to a lot of strain on the heart. And these two phenomena, the increased blood pressure and the increased thickness of the heart walls, lead to lots of heart failure events. The heart failure events are like, the patient is complaining of breathing distress, even at rest or more so on lying down. So these events increase with aging population because of these two things. Now, very importantly, these things can be reversed to quite an extent if we maintain a very good lifestyle, very good disciplined lifestyle, which includes a controlled diet, which includes a disciplined exercise routine. So then we can actually reverse these stiffness of blood vessels and the thickening of heart walls to quite an extent, and obviate many of such events which are happening with aging.
Right. Also, my next question, let me take that to Dr. Parekh. What are the symptoms of a heart attack? Are there different heart attack symptoms for women? Dr. Parekh.
Yeah, see, knowing symptoms of heart attack is very important so that early detection can definitely give you early treatment, and it saves life. The most common symptoms everyone knows is a chest pain. It is a precordial chest pain at the center of the chest. They feel uncomfortable, they feel crushing, they feel heaviness like thing. These are the common thing. But there are other features also we should remember, that unusual breathlessness, unusual perspiration, unusual fatigue or palpitation can be a sign of heart attack. Most common misdiagnosis is gases. People say that I've got a gas, but it could be one of the signs. So if it is uncomfortable feeling with gases, it is better to go to the cardiologist and show them. Now, women have little different presentation also. They can have a pain in jaw, they can have a pain in the neck, they can have pain in the back, they can have pain in the scapular region or upper belly, And this many a times we should be very careful and try and interpret and go to the cardiologist earliest so that we can take proper treatment.
Right. Which one of the two is worse, cardiac arrest or a heart attack? Can a heart attack cause cardiac arrest? Dr. Kapoor.
To understand these both things, heart attack as well as cardiac arrest, they are very dangerous. Cardiac arrest is more ominous, I would say, because it's practically a stoppage of heartbeat. The heart has totally stopped and it's not going to give us more time. So if the patient who's having a cardiac arrest is not attended within minutes, we lose a life. So that is where what you were talking initially, a cardiopulmonary resuscitation, the value of CPR holds maximum in a patient who has sustained a cardiac arrest. Now, heart attack happens, as my colleagues are also narrating, because of blockage of the artery which is supplying the blood flow to the heart muscle. So if those arteries get occluded, the blood flow is stopped to the heart muscle, and that is a heart attack. Now, heart attacks, whenever they are massive, they can lead to a lot of electrical disturbance in the heart and can lead to cardiac arrest. So heart attack can be a reason for cardiac arrest, but 90% of the heart attacks, usually they give some time for the patient to reach a hospital. And in a patient who's actually going through a heart attack, the first 4 to 6 hours is most valuable, as if we open the culprit artery which is occluded, whereby the blood flow has been stopped to the heart muscle because of that occlusion. If that artery is opened well in time, then a lot of heart muscle can be salvaged and a life can be saved, or the quality of life can be maintained of that patient. But then it should be in initial 4 to 6 hours, where we call this period as a golden period.
Right. With that, we're taking a break, but we'll be back with a lot more on our show, Health and Wellness Save a Life, after this very short break. Welcome back. You're watching Health and Wellness Save a Life on NDTV 24/7. We have expert doctors with us, Dr. Parekh, Dr. Kapoor and Dr. Muhasuddin. Let me take my question to Dr. Muhasuddin. What is hands-only CPR? What rule should a rescuer keep in mind when giving compressions? Doctor.
Hands-only CPR is amazing. It is most of the time saves lovable one. Hands-only CPR means continuous chest compression without rescue breaths. It is as effective as conventional CPR in first few minutes after cardiac arrest. Bystander CPR significantly save the lives of survival more than 2 to 3 fold. Hands-only CPR keeps blood flow to person's brain uninterruptedly after heart stop to beat. Cardiac arrest can occur anybody, anywhere. If a person collapses, check responsiveness and breathing.
Right.
Ensure the scene is clear. Start CPR. Put the one hand heel lower central chest. Place the other hand over the above this and interlocked. To push hard and fast chest compression at least 5 to 6 centimeter depth at the rate of 100 to 120 minutes without uninterruption. The elbow should be straight, force should be coming from the shoulder. It has to be continued till the medical team arrives or person wakes up. It saves more life like defibrillator.
Right. So, what if the person has recently undergone an open heart surgery and also has had a cardiac arrest? Can we perform CPR on such patients? Dr. Mukesh Parekh.
Yeah, CPR is a cardiopulmonary resuscitation, and it is one of the important tool to save one's life. So as it is described that you have to have a compression properly, so it works like working of the heart. So compression of the heart improves the circulation. Now, when the patient has undergone bypass surgery, maybe because of heart or maybe because of valve, once it is healed, it is same as normal person. So we should do, because unless we do it, patient can lose his life, his or her life. So intervening at this time is very important, and it should be once the heart is healed, then the stitches and everything are off, then it is definitely a very safe, and we have to practice CPR. It is always advisable that even the surrounding people, family member of a heart person also learns CPR.
Right. So, how important is it that people whose relatives suffer from heart disease learn CPR? Dr. Rajneesh Kapoor.
Yes. So, Divya, this is very, very important to make everybody understand who's actually going through this program that CPR is one very important technique which everybody should know about it in the public, in the family, or anybody. So, I just give you an example. There was a Denmark football player who had a cardiac arrest on the field a few months back, and we all saw that he was given a very effective CPR in the field, in the football field, and based on that, after that he was taken to a hospital and he was salvaged. He's still alive and he's again planning to come back to football. So this is an important technique which everybody should learn, and more so it should be taught to the relatives of any cardiac patient in that family. All the family members should know about it, because if there is any cardiac patient who has undergone angioplasty, who has sustained a heart attack, who has undergone bypass surgery, those persons, they remain always vulnerable to some extent for a cardiac arrest. As per data, I think I like to narrate here that 60 to 80% of cardiac arrests are usually witnessed by somebody. So it happens either in a family, in a house where other family members are there, or in a public area. But then irony is that only 10 to 20% of these cardiac arrests are actually given a CPR. So there is still a wide lag, where 60 to 70% of people who are going through cardiac arrest, they are surrounded by people and nobody is coming forward to give an effective CPR. Where we know that given an effective CPR to a patient who has a cardiac arrest, the life can be salvaged. The technique, my colleagues have given some explanation about it. So it has to be effective. Patient should be taken on a hard surface, either a road or a floor, and then effective compressions with a fist like this should be done over the chest very fast and continue until some help, some ambulance arrives. This can actually salvage a life, and we have done it in many contexts, whether it is an emergency of a hospital, and I was traveling in a train and there somebody had a cardiac arrest and I could salvage a life giving a CPR in the aisle of the train. So this is a very effective technique. There is no doubt that there should be more awareness, and I am highly grateful to your program because you are actually trying to disseminate this message of CPR and other techniques to save a life through your program.
Doctor, it's very, very crucial that everyone should learn it. It's not just people who might have relatives in their family who suffer from heart disease, but just about everyone. You just never know when the need arises. Now, we read a lot about antioxidants. How do these promote a good health? And what are some of the foods that are the highest in antioxidants? Dr. Mohasuddin.
Yes. So free radicals are harmful molecule produced when our body breaks food or our body exposed to tobacco, smoke, or radiation. These harmful free radicals promote beta oxidation of the bad cholesterol. Accumulation of the oxidized bad cholesterol is central event for atherosclerosis.
Right.
The antioxidants are healthy food freely available in vegetables and fruits that halt the deleterious harmful effect of the free radicals. The antioxidants are vitamin C, vitamin E, carotenoids, flavonoids, resveratrol, selenium, magnesium, beta carotene, alpha lipoic acid, and coenzyme Q10.
Right. Very interesting to know that, Doctor. Also, it's said that monosaturated fats such as olive oil can actually be good for your heart. Is that correct? And what type of oil is most beneficial for use by people with existing heart disease? Dr. Mukesh Parekh.
See, our first instruction to the patient is avoid oily, fatty and fried foods. But you cannot go on zero oil. So we have to learn to have a proper oil in our diet, whether it is cooking, eating, but it is very important to choose the healthy oil. Now the best oil is a plant-based monosaturated fat oil, and olive oil is one of the best thing which one can use it. So I think it is olive oil is the healthiest of all. But I would like to add one more thing. Olive oil is not water, it is basically oil. So as much as we reduce the intake of oil, whether it is olive or other, then it is always better. We can have different modus operandi like air fryer and everything can be used. You can have a batata vada in air fryer, not in oil, that sort of a thing. So reducing oil to the maximum is the best. But if you say which oil, I would say that olive oil is definitely better compared to any other oil.
Well, new studies suggesting that air fryer could also trigger some other sort of illnesses. Well, there's a weird myth that if you don't eat meat, you don't need to worry about heart disease. Is there any truth to that? What's the fact? Dr. Kapoor.
Yeah, so this is again interesting that, there are many foods which definitely enhance the risks of heart disease, and red meat is one of them. So red meat has very unfavorable cholesterol or fats in the meat itself. So that leads to genesis of a blockage inside the arteries very fast, and that leads to heart disease and more predisposition for heart attacks. So red meat is definitely no, and we tell all our patients to avoid red meat, and as they are heart unhealthy. But I would go a stretch forward. I won't say even the white meat like chicken is very good, because most of the times in Indian kitchens we cook a meat as a deep frying thing. Deep frying is one method which is very popular in Indian kitchen, and deep frying itself is heart unhealthy. So overconsumption of deep fried chicken is also not good. Yes, grilled or barbecued white meat is better than red meat, but red meat is absolutely no and should be contraindicated in all heart patients. Now, that doesn't mean that other foods are not. Other foods are also harmful. As I mentioned, the deep fried vegetarian stuff, more consumption of sweet stuff, more carbohydrates. They are also not considered heart healthy. The processed food which has more carbohydrates are the nemesis of any diet. So we should be really careful, not only with red meat, but also with other food items like deep fried items. Now all deep fried items are enriched with trans fatty acids. Trans fatty acids are big villain for heart disease. They have maximum predisposition of adhering to inside the coronary vessels and causing the blockages and leading on to anginas and heart attacks. So we have to be careful. Now on the contrary, there are healthy foods like salads are very healthy. Fruits are very healthy. Nuts, almonds and walnuts are considered rich in good fats. They are also considered heart healthy. So there should be a good balance. We should be, taking more of healthy stuff and restricting unhealthy stuff like red meat and the fried vegetarian diet.
Right, very interesting. Thank you so much, Dr. Kapoor, Dr. Muhasuddin, as well as Dr. Parekh for joining us today. With that, it's a wrap. We'll be back tomorrow, same time, same place, with our show Health and Wellness Save a Life.